I mean, one of the problems is clinicians may actually mistake symptoms of ADHD for another disorder. So the first thing you have to think about is, you know, could it be ADHD that explains the person who appears to be presenting with anxiety or depression? And you can think of reasons why that occurs. One of the things we've learnt about ADHD is there's a very strong relationship to emotional dysregulation. So it's not only the inattention and the hyperactivity that people present with, but also problems with sort of volatile, irritable moods and kind of overreacting to different situations. And this can then lead people to other diagnoses. It can look a little bit like a personality problem or a bipolar disorder problem, or even anxiety and depression, to have those kind of volatile mood symptoms. And there are many behaviours that relate to ADHD that can look like other conditions. So people with ADHD, they don't like busy shops, they don't like waiting in queues, and that might lead them to avoid certain situations. Or they may feel difficulty in social situations because they find it hard to communicate with people. If their thoughts are very distracted, they can't kind of hear easily what's going on in a group of people, they may just avoid those situations. So it can look very much as if they're sort of phobically avoiding situations when it's actually related to the ADHD. So that's kind of one sort of very important area that clinicians really need to understand what are the core symptoms of ADHD to make these distinctions between ADHD and other disorders. Of course, ADHD is a very, like many conditions in psychiatry, it has a very broad range of expression. And I mean, in particular, the balance between inattentive symptoms and hyperactive impulsive symptoms is important to think about. And so not everyone with ADHD is very overactive or very restless, and they may be really suffering predominantly from problems with their concentration, organisation, forgetfulness, and those kind of problems. I mean, the majority of people with ADHD do show some level of restlessness. But it's not always a sort of an extreme symptom in all patients. The other thing to look out for is when you're actually interviewing people. It's a situation. I mean, one of the things about ADHD is the symptoms are also quite sensitive to the environment that you're in. And when you're in a situation which is very important to you and very meaningful to you, so it really grabs your attention, that often actually reduces the symptoms of ADHD. So in diagnostic interviews, you may often see that some patients don't appear to be that restless or inattentive or impulsive, but if you ask them about their normal, typical working week, or you talk to their families, you'll actually discover that these are problems they have most of the time. So it has this kind of interesting kind of property that they can be good at some things, and particularly things that are very meaningful to them. But that's not to say it's not an impairment, because people may view that as a trivial problem because you can function in certain situations and environments. But the main problem is actually most of the time they can't, and it's only in very specific situations, or they may hyper-focus on one or two things. But that's not to say they don't have a significant impairment most of the time.